All right, this is Joshua Yamson, inflammation reduction therapist, and we're here with Michelle Mims, Indy star. And this, she's here with us. Testimony too, all of that. And we're here with some friends around us here. What we're going to do today, we're going to just help her with a shoulder issue that she has. By the grace of God, we're going to move that shoulder issue based on the therapy that I do to remove pain naturally. Your lymphatic system of your body is the drainage system of the body. And you have lymph vessels and lymph nodes. And what happens is that when that gets clogged up, that's where the pain comes in. Your body's trying to release toxins. It's trying to remove all the old blood proteins. That's what that system is there for. But what happens, those lymph nodes and filters get clogged up and everything backs up in the system. That's what causes the pain. Now what happens with a lot of women is that they have pressure in the pelvic area. A lot of fluids kind of get caught up there. And men, a lot of times it's your prostate. And these fluids get stuck here in these areas where they're not dumping. Okay. So what happens is that when that gets clogged up, you start getting pain back up in other parts of the body. For example, if you stand, you might see that you're kind of leaning a little bit this way. That's because you have the pressure here. And then when we move the pressure here, you're going to stand straight. Some people have the back lumbar issues because of that. And a lot of times when you use your arms a lot in women, they get a lot of stretch in the shoulder, so it'll show up in the shoulder. So you have pain on this shoulder right now?
This one.
This one right here. What we're going to do first, we're just going to work on her hands. First thing we do, let's kind of access your feet. Hopefully I won't get out of the camera here. I just want to hold here. Don't worry. Okay, now we see let's see. No, it's just like you're a little long on this. Usually it would be short on this stuff. You're a little long on this stuff. But that's okay.
Okay.
All right, now, we're going to get all that done. Let me have you. What I want you to do, you remember the movie Miyagi, Daniel-san, he told him to breathe in through your nose, out through your mouth. He says, in, out. Remember in, out? You don't remember that? In, out. In through your nose, out through your mouth. The lymphatic system doesn't have a pump, so we have to create a pump by breathing. Now I'm going to access your pelvic area in your hand, okay? So I don't have to access that. You're not on the table.
Okay.
You can access your pelvic area. We're going to open that up now.
Okay.
It may be real tender here, okay?
All right.
So we'll do a gauge of 10 being extreme pain, 1 being normal. But don't worry.
Okay.
Even if it's 10,
Okay.
it will be 1.
Okay.
Naturally. All right, so I'm going to press in here. I want you to breathe. Now, what number does that feel like there?
3 maybe.
Okay. Not too bad. Now just breathe.
5.
Going up. Okay, good. All right. Well, not good. Breathe. As you breathe and you keep breathing, she said it was like a 5. So that's like about 50% of extreme pain, okay? Is it going down? Okay. Now you feel that movement? I feel your fluid moving. You feel that? Okay, that's the lymphatic system. We're opening up the lymphatic system. We're opening up the fluids in her pelvic area right now. Because she's got a lot of fluids kind of clogged there. And that's where her problem really is at. It's showing up in the shoulder, but that's not really the issue.
I'm sorry.
So you're laughing a lot for some pain, ain't you?
Your wording.
It's a fun therapy, you know what I'm saying?
I'm trying to breathe again.
Some of my clients be ticklish, boy. But we get them through it. By the way, I give all the praise to God for this knowledge and this work because I know it's only Him doing the work through me. What number is it now? You don't feel anything, do you?
1. If anything, that's
You can feel the pressure in my hand there. Okay, here's what we're going to do now. She's got a pain right here in her shoulder right here. Now, on the front of the hand, everything on this side of the body is in this hand. All your organs are show up in the front of the hand. On the back of the hand, where the bone side is, that's the back of the body. So, are you having the pain in the front area or is it in the back area? Okay, right in this here, right here. Okay, all right. What we're going to do is, now, hopefully I can get this done on the hand. Sometimes with women problems, it may be the axillary nodes, which is kind of like underneath the arm, and then a lot of areas in here. But we're going to see if we can move this without we having to do that, because we're just working on hands on this video, okay? So here's what we're going to do. I'm going to hold this area here. I'm going to press in about right here. And About right. It should be tender right here. What number is that?
Cut 3.
Okay. All right. Go ahead and go read. That's her shoulder area right now we're working on. Just read me in now. Now this should relieve the pain in the shoulder. I can feel it moving right now. Something jump right there. Is it getting better?
I don't know. I can't feel anything right now.
Okay.
Like this.
All right.
I don't feel any pain.
There you go. She's breathing in and out. Nice breathing, pumping lymphatic system. How does it feel back? Is it gone? The spot pressing?
Pain?
Mm-hmm.
I can feel it in the front of my hand.
Okay, okay, what number is it?
It's like a 4 and a
Okay.
half.
All right, 4.5. Okay, so I want you just to deep breathe. This is the pain. This is your shoulder pain, that 4.5. Okay. Just relax, and you'll see it go down. There you go. Now it's going down there.
Yeah. It's hurting. It's bad.
Mm-hmm.
It's not hurting as bad because it was hurting.
And I haven't moved the pressure off of the hand. All I do is just hold that pressure. And when she breathes, excuse me, it opens up the lymphatic system. So it opens up the lymph node that's clogged up in that area. And these lymph vessels, they are, just like you have arteries and veins, the lymph vessels are also in that tissue. So within the muscle, you have all these different things going on. The lymphatic system controls the length. Because when it's clogged up, you can see that your nerves would be bottled up in that tissue. Your veins can get clogged up in that tissue. When the lymphatic vessel releases and the lymph nodes are opened up, then you find that your body stretches back out. How's it now?
Better.
What number is it?
Maybe a 2.5.
Okay, we got to get all that out. We don't want it to be a 2.5. We want her to be normal. Just deep breathe and relax. She was very clogged up. And that's why she had the shoulder pain. Now if you notice, I haven't touched the shoulder.
Feel it tingling in my back.
Mm-hmm. And did you have any problems in your hip area or anything in the lumbar, or just the shoulder? But it's opening up. That's why she's feeling the tingle. What happens is that pain blocks the cell-to-cell communication because your cells are in a body of fluid and they don't touch one another. That's what causes inflammation. When the lymph vessel opens up and it drains out, then the cells can communicate by touching one another again, and that's normal. So we just want to get her system to be normal. And that's what's happening. She's feeling the sensations because the nerves and the cell-to-cell communications coming back. How's it now?
We're at a 2.
Mm-hmm.
We're at a 2 here on the hand.
Right, but you okay?
And pressure. Now.
It's gone.
Yes.
Okay, now what I'm going to do, I'm just going to kind of just, kind of work on the hand a little bit here. This will feel real good for you. It's like a little hand massage here. Just let your hand go loose. And one thing was she was really tight. I forgot to tell loosen her wrist. She was like this. Probably like took some longer. You want her to relax. She's like, we'll loosen her up. See, this will loosen her right up. Look. It's an honor to work on Indy Star. It really is. This is the movie star in Indiana right here.
Yeah.
I remember when she first got started. She is a very good actress. Okay, now let your hand go. You can lift your arm around your shoulder. How does it feel?
Better. Because it was like a lot of pain right here. Even when I would touch it, it would hurt.
Now you can move it.
No, I'm